Indrani Kar. I'm a drug policy and formulary manager at University Hospitals Health System in Northeast Ohio. We're a really large health system, over 20 hospitals, and I'm really fortunate to do what I do. And I actually didn't know it was a career as part of pharmacy. So that's something that we'll talk about today. I grew up in Pittsburgh. I went to University of Pittsburgh for my School of Pharmacy training. And then after my Doctor of Pharmacy degree, I went to University of Missouri, Kansas City for a drug information fellowship. After I completed that 1 year, it was very focused in drug information in the academia space, teaching students, taking the time to run a drug information center. I then got the chance to do a PGY2 program in drug information at Rutgers and Robert Wood Johnson University Hospitals in New Jersey. After that, I showed up at UH for formulary and policy. Getting inspired to do pharmacy is so interesting because it was just another item I was looking at. I shadowed a lot of pharmacists when I was in high school, and I loved chemistry and biology, a very generic answer, but it was true, and I was really excited by seeing different types of careers that pharmacists were doing, and I thought it would open up a lot of opportunities no matter what I decided. So I thought it was a versatile option, and that's why I went into it, and I happen to be in something that is super versatile and very different. None of my days are normal. In formulary and policy, you have to understand what a formulary is. A formulary at its very root cause is a list of medications based on the efficacy, safety, and financial need to the institution to make sure that we can safely take care of our patients. But that requires a lot of work. We have to evaluate all of these medications. We have to look at all the literature, all of the safety aspects of it, and of course the finances. And every part of my day is making sure we are maintaining our formulary process through different committees, a lot of committee work, a lot of project work, and supporting our system formulary for adults and pediatrics. And then my other hat is system policy. So writing policy, a lot of working with a lot of different people across our whole frame. That's my favorite part of my role. I get to work with every single person in our whole organization, from our frontline clinical pharmacy specialists to our pharmacy managers to our chief physicians to our CMOs to our CEO. I had the chance to work with him just over the last year on a project. So it's really exciting, and you get to impact patients on a really big level, and that is something as a student, high school student, and then even in college, I didn't really know that was a thing. And as I started exploring it in pharmacy school, I thought that's what I want to do, and I'm very fortunate to do it every day. My favorite part of my job is getting to work with everyone every day and getting to impact patients on a really broad level. We are not just getting the chance to impact someone today, we're impacting patients who come into our doors all the time. And I'm a very big picture thinker. I like to help people take care of other people. And a lot of my work is behind the scenes. I'm not seeing patients on the front line, but we're supporting all the guidelines and policies and formulary needs to help our frontline take care of patients. So it's very exciting. It's very scary when you're early on in your career to even put yourself out there and try to understand what am I going to do? What is my career path going to look like, and where do I fit? I wish someone had told me you don't have to figure it out immediately. You can try things and put yourself out there into different opportunities that will open your eyes to things that you find yourself passionate about and interested in. And you just have to ask a lot of questions. Ask questions of people, ask your professors and your colleagues and others on why do they love what they're doing, exactly what we're talking about today, and see what clicks with you. And that is something I had the chance to do as a student, something I tell all of my students when I teach, and they come on rotation with me or my residents. So it's really just asking questions and being open to it, and you don't have to figure it out right now. You can take your time, and it's okay.